Assalamu alaikum. My name is Fawad Khan. My background is in Bachelor of Science in Human Kinetics, and I recently graduated from the medical school at Queen's University. There's a lot of things that pushed me towards going toward like a different country to serve Jamaat. One of the biggest motivations for me is that I'm a Waqf-e-No, and I know that my lifelong goal is going to be in service of Jamaat, and Hazur might be sending me to different countries around the world. And what better experience than now when I'm young to be able to experience that while I'm still in my profession and still learning in school. I was fortunate to have the opportunities to go to different countries. I've been to the UK for Waqf-e-Ardhi around the Jalsa time for a couple of years. I've been to Senegal as well, where I helped run a medical camp for a few weeks in different villages around there, basically providing free medical aid and services to people who just don't have any resources at all or services that they have access to. In Senegal, I was actually part of the Humanity First team there, and I was fortunate to have the opportunity to work with a physician there. There were nurses and different healthcare assistants that were part of the team down in the ground zero in Senegal. My role was sort of as a medical student. I was still a learner, but I wanted to be able to sort of create something in Senegal that I knew we could do at least annually, or create something that was sustainable. And so when I spoke to the Humanity First team in Canada, our plan was to create medical camps that we could run at least every year or every few times a year. And so when I went to Senegal, the first few days were probably the biggest challenge. For me, it was the French. The language barrier was very challenging in order to communicate with the patients and people and the local authorities there. Myself and our team, we worked on sort of overcoming those barriers. But eventually, alhamdulillah, by the grace of God, we had a few days straight where we ran medical camps, served over thousands of people, where we gave them free consultation services. We provided them medications, prescriptions. We even gave them guidance in terms of if we weren't able to fix their problems right away, what they could do down the road. If they needed to see a surgeon, we even sort of arranged some sort of consultation for them to see a surgeon if that was required. With regards to our living arrangements in Senegal, I personally stayed in a residence that was actually right beside the Humanity First Hospital, sort of on the outskirts of Dakar, Senegal. In terms of like my food arrangements and everything else, I was fortunate the Humanity First team there was providing me everything that I needed in terms of food. Even in a short time when I had been sick there, they provided medications and whatever I needed. As a healthcare professional, I tried my best to help people in the villages to my utmost capacity. But one of the biggest challenges is the fact that there are many villagers and people that came to see myself and even the other physicians that were there in the clinics, and you almost feel helpless at times because you might not be able to help them in that moment. There may be a tumor or whatever it might be that it needs to be surgically excised, and it's something that we don't have the capabilities of doing. At the same time, coming for Waqf-e-Ardhi to Senegal, one of the things that you learn is that you can always help these people by praying for them, and then hoping that inshallah that God gives them ease. During this time as well, and after when I had returned, I'd written letters to Hazur asking for prayers for this trip. One of the benefits of writing letters to Hazur is that as soon as you've written it, even though you haven't received the response, you feel like the blessings of Khilafat are behind you. And so I think that was one of the things that helped me during the trip as well, with even all the hardships in terms of the language barrier, the weather, and just being in an uncomfortable environment. I knew that my intent was to do this for God and to serve Jamaat. And I know that down the road when I serve Jamaat as a Waqf-e-No and Waqf-e-Zindagi, this is part of my training. And so you always ask, it's always best to ask Hazur for prayers, because he can help you in these situations. Even though the Waqf-e-Ardhi, the trip itself was very short, it was only about 2 weeks or so, we ran a few camps, and there were over over hundreds of people that we affected in terms of providing them medications and sort of helping with their ailments. And in terms of an indirect help, might have been countless, hundreds, maybe even thousands more that might have been affected by just our presence there and just seeing maybe the activities that we were doing. Maybe that inspired some of the other locals there to help out in terms of whatever their capacities might be, even if it's not in the healthcare field. This also had an effect on myself, just being out of your comfort zone, doing something that sometimes you only hear in the news stories, you might hear just in a video like this. It's really something that's very hard to describe unless you go there and you experience it physically, mentally and spiritually.